again, everyone. Mark Hackle, Macomb County Executive. John Paul Ray, Deputy Executive, just giving you an update on what's going on with the COVID-related issues. Just after the holidays, Thanksgiving. Hopefully you and your family had a decent time, even though we had kind of the COVID restrictions going on. That socially distancing, kind of limiting the number of people in our family. We still had a good time and try to keep it somewhat traditional. I got to believe at the Ray household they did as well.
Absolutely, Mark. Had fun with Roberta and the kids around the household and everything. Had a chance actually to get out to Stony Creek, go for a hike in the woods too. So definitely a little bit different flavor this year, but it's always enjoyable to have time with the family.
All right, dessert. We can talk about all the other stuff we eat, but what was your favorite dessert?
I would have to say this year the Dutch apple pie definitely took. Yeah, it was pretty good. We enjoy the Varellans orchards as far as the pies. So I know there's a big debate around the county as far as Varellans, Blake's, Westview, where have you, but that's where we ended up deciding to go this year, and it was pretty enjoyable.
Yeah, well, I go to Hilltop and get my pies. They got them up there. They make them out of a barn over there. Ruth does. Great pies. But I got to tell you, my favorite, believe it or not, is sweet potato pie.
Oh, okay.
Favorite.
Okay.
All-time favorite.
Good.
And again, close second would probably be the pecan pie.
Okay.
At any rate, now that we got that out of the way. You know what? It was also a time to be somewhat concerned because we know there has been this continuous uptick that we've been seeing, and it's a real issue. Specifically with our healthcare systems, the hospitals are inundated. Looking for bed space is a big challenge. We're hearing it all over the news. You're hearing about it from everywhere. It is out there. People need to continue to take the precautions, be careful, and with that, we know there's plenty of test sites available, and the testing sites, we've been seeing incredible numbers of people coming through those facilities. I think we're breaking all-time records, as a matter of fact.
Yeah, Mark, already to date in the month of November, we've had over 106,000 tests alone in Macomb County. Again, these numbers are fluid day in, day out at the county test site, now being 5 days a week and everything. We're able to meet the capacity as far as individuals looking to get those testing needs, whether it's our test sites or the multiple private test sites that are around the county too. So meeting that demand, again, advising individuals to continue to follow those CDC guidelines as far as taking those extra precautions with the mask, washing the masks and washing your hands and the social distancing. And then again, one of the key things, any symptoms at all, if you're feeling sick, again, advising individuals to stay home and again, keep your distance on that front too.
I think pretty much people already know. They understand, the risks that you're taking by still engaging and doing the things that you're doing. But we do see more people wearing masks than ever before. That's part of the solution. But the bigger part of the solution is going to be the vaccine, when it gets here. And we know it's coming. There's going to be this tiered phasing in, if you will, when we say that, meaning who gets to go first, those that choose to take this. And that's going to be a matter of choice as well. Maybe some companies are going to require it, or even the healthcare systems, the hospitals will probably require it. But there's going to be a tiered approach as to who gets it. And all of this is going to be dictated by the federal government as well as the state, how this plays out. Here in Macomb County, no different than any other county in the state or municipality, as well as probably in the country, we got to follow these guidelines. And so with that, we're just getting ourselves prepared for when it comes. We're going to get a lot of questions, emails, people phone call, wanting to know. Media is going to be on board with this, trying to figure out how do they get people to know that it's here, the vaccine, and now it's being distributed. We want to make sure people understand that there is a tiered approach to this. So don't be coming knocking on a health department door saying, where's mine? There can be plenty of information, public awareness as to how this plays out. But here in Macomb County, our health department is on board, trying to make sure we have the right locations for when we have to make the distribution of this. Again, there's going to be the one you get one day, and then you got to wait 21 days for the second one. So there's a lot that goes into this, an incredible amount of time, resources, personnel, and cost associated with this as well. But here in Macomb County, we're preparing for that. We're just trying to get people to understand that it's going to be a progressive approach. Information will come your way. You just need to kind of be patient with that if you're one that is standing in line wanting to get the actual vaccine itself.
Mark, however this process rolls out as we continue to follow those guidelines from our federal partners and state partners, we have the necessary resources and teams available to deploy and ensure that we meet the Challenger objective here. So as we get those phase-in criteria, as we look at attaining whatever vaccine comes down through the county and everything, we will deploy those steps most appropriately to inform the public of which individuals will be able to have the opportunity to engage and receive the vaccine, and also when those other phasing criteria will come in, when those allotments come down through the federal protocols and the state protocols also.
Yeah, and so what we're saying is, is that we're not trying to complain, okay, because there's not a lot of information out there. So in other words, we're not getting a lot of direction from the federal government or the state because there isn't a lot of that just yet. They're still getting them in, the actual vaccine. Now the question is, how does this get paid for? What are we going to be doing as far as distribution? Who's going to be first in line? We have an idea. Healthcare workers first line, or I should say frontline workers, the people that are kind of essential workers. Mm-hmm. But for the most part, After that, we're not really sure what we're going to be told. So we're not here to complain. We're here to prepare ourselves. Much like we made the announcement about the freezers. We were able to get the freezer. We were the first county in the state to get the freezers because we wanted to be prepared. So we are prepared. When the information comes our way, you will have that information. Pretty much the county will be taking the lead for what we're doing here in this county, along with maybe some of the private companies. They may be part of this. I know the healthcare systems will be. And we may be assisting a couple other local counties as well, some of the counties to the north of us. So that's still to be determined. But we will make sure you get all the information you need once we get that information available to us.
Yeah, Mark, as we've done through the outset here, it's leveraging macombgov.org, getting the most essential piece of information out to the general public, and then most importantly, having that partnership-driven model. As you said, it's going to be helping out some of the surrounding counties. It's going to be working with our state partners. It's going to be engaging that we coordinate with our emergency management liaisons at the municipal level. This is going to be part of that continuous process in which we've been a leader in that space, and most importantly, assuring the public that when they choose to engage, this is the best way in which they can do so.
Yeah, so credit to our businesses that are keeping their people safe by still keeping their doors open and assisting by making sure they're available for people, whether it's a restaurant, someplace where they're selling items. It is the holiday season. People are shopping. We do have this, I guess, if you will, contest going right now where you can shop local, MakeMacomb.com. You can actually find out more details or information, a chance to win $150, give back to a retailer $1,000 just by going to MakeMacomb.com, purchasing something and uploading it. Very simple. Hit the icon. It'll explain you exactly what to do, how to do it. Easy way to make $150 and help a local business here in Macomb County win $1,000. So 20 people will win $150, 20 people or businesses will win $1,000, and this contest goes until next, I think it's next Monday, if I'm not mistaken.
Yep, at noon.
December 7th, we're going to be drawing the names of the people that win, and we're going to be doing that some kind of a virtual way, I guess.
A little Facebook Live option
Facebook
there.
Live, yeah, that's what that thing's called, Facebook Live. So we're going to be doing it on the Facebook, and again, we want to remind people to continue to shop local. Also, a credit to our schools, continuing to try to figure out how they best educate our kids through this pandemic has been a big challenge, but the other part of that is getting food resources to families that are in need right now. And I've seen some long lines at some of the facilities they have. They're still trying to provide that option for families. So Mike DeVault ISD and our school districts, a lot of work being done by our teachers, and it's different. And again, some of the challenges the kids are facing through this process has been incredible. I see it at home. Some of the kids that we are dealing with, our nieces and nephews, it's far different and a bit of a challenge, but people need to still be patient with it. So thankfully our school districts are on board.
Mark, the work that's been done not only through our local school districts, but also through the Macomb Food Program has been one of the chief accomplishments throughout this COVID challenge and everything. The ability for us to get out meals to those individuals that are most needy throughout our community and everything. And as we, transition here into the holiday season, it's another one of those challenges that is going to be ever present, but we have the resources in place to meet that need. Just need a little bit of patience as we're, going through all the operations and stuff like that.
And speaking of patience, weather is changing, and you can probably tell as you hear this, I guess if you will, update. There's going to be a little bit more challenge with our weather and the snow and everything. People, once again, be mindful of how you travel. So making sure you're cleaning off your car before you take off. If you see slippery spots, slow down. Whether it's coming to an intersection, making a turn, or coming to a roundabout, getting off a freeway ramp. Be very patient, but more importantly, be patient with the folks that are out there. If we have the real bad snow coming up into the future here, the folks that are out there plowing our roads and salting our roads. Our road crews are going to be out there full force. They haven't stopped since day one, trying to figure out how do we fix roads, fix potholes, but now we're going to be dealing with the challenge of figuring out how do we clear the roads. So with that, be mindful of it. The challenges are coming when it comes to our weather changes, but again, like everything we always say, we want to continue to remind you on a daily basis to keep you and your family safe.